All right, we're now live. I think allotted at least 15 or 20 minutes to each of our films. We have a double feature to discuss today. We'll go in chronological order by date or year of the premiere. So let's start out with A Fatal Attraction. Any opening thoughts, comments, observations on A Fatal Attraction?
How explain the criteria for borderline personality disorder so we can get more information in different domains of impairment potentially?
Okay, so if we're focusing on the character of Alex Forrest, maybe behavior consistent with borderline personality. What did you see? What would go in support of this working diagnosis?
Self-injurious behavior.
Self-injurious behavior. Could you give us the scene?
She cuts her
wrist. Slits her wrist when what's his name?
Dan?
Dan tries to break up with her.
Okay.
Yeah.
Any other evidence to support borderline personality?
She built this affection with him in a short period of time.
All right, so certainly over idealization and even devaluation, which would be consistent with what?
splitting.
Yeah. So we think that Alex Forrest may actually incorporate, perhaps even rigidly, splitting as an unconscious defense mechanism, as a process of the ego, right? By the way, I love the picture where she's waiting for him in his office, comes and visits. She's sitting in the room waiting, and above her is a portrait of a older Caucasian male, almost like a father-type figure, and she's wearing black and white. I don't know if the writer-producer thought to create that symbolism, but splitting.
Mm-hmm.
Any other signs that might be consistent with borderline personality?
Fear of real and perceived abandonment when he rejects her.
Yeah. Is there anything? And yes, definitely. And then frantic efforts to avoid abandonment, acid on the car, whatever. There's certainly the way Hollywood would certainly want to portray this, or choose to portray this. Any evidence to suggest this is even more to this?
Oh, the past, when he opens up the folder and there's a past person that has died, like the cardiologist or some heart attack.
Her dad.
Yeah.
That was her dad?
That's her dad.
Yeah.
Okay, yeah.
Yeah.
She lied about. She first lied and said that wasn't true, but it in fact was true.
Yeah.
He looked in that file.
Yeah, yeah. So again, when we see the file, certainly there's more to it. I think when it's initially presented, we're like, oh, okay, it was a weird kind of joke or gesture, and but then we find that there's something much deeper there, and then we can connect the two. We get a better understanding of why she is acting the way she does towards Dan. When we uncover that history, there's much more to it. Which, by the way, just begs the question: why wasn't the prequel ever made?
Mm-hmm.
But nonetheless, any other thoughts about borderline personality and Alex Forrest?
Just the emotional, lability and emotional dysregulation.
Yep, a lot of it. And I think on the surface, at least scene by scene, it's appropriate to what Dan's all about. But I think taken in a larger context, and certainly when we think that there might be a history of this, again, stability from perhaps even late adolescence or even younger, it may be a personality.
And we talked about self-harm, but, specifically using self-harm to manipulate.
Yeah. Yeah, I'm also sure that there was a true intent to die, so we often refer to this parasuicidal behavior or non-suicidal self-injury. It's a mouthful. NSSI.
When she goes to attack the wife too, she's cutting herself first while she's talking to her.
So let's talk about that a little bit, because that's yet another diagnostic criteria, and one that is separate from splitting / self-injurious behavior or suicidal gestures. What's going on there? As we observe it, I'm not so sure she's got she's demonstrating or depicting a suicidal gesture there, but she's demonstrating something that is, yes, another criteria for this condition known as borderline personality.
Anger?
Hmm?
Anger?
Definitely anger, we missed that one. So let's check that proverbial box as well. But again, and I think there's multiple scenes, and I really need to say this out loud, in which her anger, I think, is substantiated. But again, in the context of everything else that this group has already brought to light, it does also appear to be consistent with her personality too.
Delusion.
Hmm?
Delusion. Like she's telling her like you're taking him away from me when like that wasn't the case.
Let's work with that. What else? What else is going on here?
She doesn't seem, it's like a depersonalization.
Yeah, she's dissociating. Yeah, she's dissociating. Now, why would someone who is dissociating stab herself in the thigh like that?
To reconnect with her body.
Yeah, yeah, and that's very consistent with not only borderline personality, but borderline personality that itself manifests as a result of what?
Trauma.
Trauma.
Yeah.
Yeah. More specifically?
Sexual trauma.
Sexual trauma, and then even more specific to that. Sexual trauma where the individual, in this case a young Alex Forrest, dissociated. Hypothalamic response in that particular time, again, where's the prequel? Fight, flight, not available. She probably tried and unsuccessful, unfortunately, so freeze. And now what was an adaptive response when Alex was young becomes the maladaptive signs and symptom when she's older, consistent with borderline personality. Well, again, we only need 5 symptoms, and I think you need 7. Talk to me, one of the things you brought up that I think deserves special mention, a little bit more discussion, is that scene in Central Park where she discloses to us, well, to Dan, to us, that he's insensitive because her father died of a heart attack. No, just kidding, alive and well in Utah, but probably not. And then Dan realizing, I think it's like a scrapbook or a file, that he is in fact dead. I timed it. That's 37 minutes later. I nerded out on this, right? That's 37 minutes later. What's the relevance there? Connecting those two scenes. Now, we talked about abandonment. That's certainly, again, a diagnostic criteria. Within those 37 minutes, she actually demonstrates every single sign, every single DSM criteria of borderline personality disorder in 37 minutes. And that connects abandonment, initially presented, withdrawn, and then confirmed later on in her apartment when Dan breaks in. Anything else about Alex we should discuss?
Maybe the fact that she took the child's rabbit and that was pretty traumatizing.
Yeah, it was. And one of the more infamous scenes in all of film history. When you watch this movie, somebody mentions the boiling bunny scene, and there's multiple allusions to this in multiple other works, including Family Guy, which again makes it real then, right? For those of you who are a fan of Family Guy. What about that bunny? What about that scene?
She has seen them happily in like a family setting, and then she went for that to like harm everyone.
Mm-hmm. Anything else? True, definitely
Very
true.
antisocial.
Yeah, I mean, she begins to demonstrate a blatant disregard for and violation of others' rights. Now, again, I don't think she has antisocial personality disorder per se. Don't know if she does or not. Don't believe she does. But it is a reminder to all of us as future physicians that these different conditions can cluster and often do share common signs and symptoms. So the fact that we see really the cardinal sign of antisocial personality should not at all surprise us in working somebody up for borderline personality. And by the way, narcissistic and even histrionic personality as well. So just a reminder that our patients don't fit neatly into these artificial categories that we create for them.
Sure, because, even beyond, because in borderline personality disorder, we do see that, like, lability and these, like, obsessive really rapidly progressive like relationships and the relationship instability, but specifically, you know, that this was an affair, you know, like a disregard, right, for the other people who are harmed by this.
Mhm. Which of course comes to head in the final scene, which is really interesting because the way or what you saw was not what we were initially intended to see. This movie has a wonderful deep dive. I don't know if anybody took the opportunity, but it's got a remarkable deep dive because when it prior to it premiering, it went through several revisions. The first of which was that Alex Forrest dies by suicide, right? But the audience that was provided the preview voted that down. They said no way. When the actress that portrays Alex Forrest is called back, it's Glenn Close, and you could actually see again multiple interviews, including a "Where Are They Now" segment. The actress walks away and says, "No, I'm not going to do it." So she goes back. I think it's shot in Manhattan. She goes back to California. The writer-producer sends a psychiatrist out there to convince her that people with borderline are more likely to die by gunshot than they are suicide. No idea where this is, right? This is now the 80s. No idea where this is coming from. Clearly, this is not evidence-based. Clearly, individuals with this condition, that's borderline personality, are at risk for suicide and do not kill people, right? Or do not die by gunshot. Not with any increased prevalence when compared to the general population. But yet, there's a psychiatrist out there that believes that. And that very psychiatrist somehow is flown out to California and meets with Glenn Close, convinces her to come back and reshoot the scene. Pardon the pun. And does. The idea here then is that initially when she's supposed to die by suicide, frame Dan, who then gets the electric chair. But audience votes that down. And I think there's it's like a third or fourth take where they finally actually agree that she'll die by gunshot. They want Ann Archer's character, they want Dan's wife to actually kill. And again, after convincing the actress that this is actually how people with borderline can die, she actually agrees to shoot the scene. Now, she should have consulted another psychiatrist, maybe at Robert Wood, who would have told her differently. You know what, you got this right the first time. But nonetheless, she does agree to shoot the scene. I think it's like a third or fourth time. And in that fourth take, she dies at the hands of Dan's wife. So it's an interesting deep dive. Other thoughts about any of the characters here?
Well, I felt like towards the end, right, like what Dan's daughter and his wife went through, there was a lot of avoidance, there was a lot of increased vigilance, hypervigilance. I think they definitely had PTSD towards the end of this.
Yeah, and I always thought that Ellen is the forgotten character in this movie. You know, I mean, of course, as I think any audience member would go, I'm trying to be politically correct, always put the children first. Yet, that's the forgotten character here. So that's a very interesting observation. I agree with you. I mean, significant trauma. And this little girl, 6 or 7 years of age, is relatively ignored. By all involved, including the audience.
She was kidnapped for a whole day.
Yeah.
And that wasn't really addressed afterwards in the movie.
No. And her bunny. And she's the one who discovers the bunny, right? There, you know, we do identify with her, but even then, her character's kind of neglected, and which is, again, very interesting take on things.
I was, the last scene, so the whole time I was thinking, because Ellen woke up when her parents were fighting, when, I forget the last name now, but when she found out about the affair. She comes out into the hallway holding a little stuffed animal. Like, that's very traumatizing. But I was just thinking in that last scene, when the gunshot goes off, where's this poor girl? And I'm sure she would have heard all of this in the house. Mm-hmm. How traumatizing.
Yeah. So definitely something to keep in the back of our minds. By the way, there is a scene or a little earlier that is prior to the infamous bunny scene, where Alex tells Dan that she's pregnant. Do you believe?
I do.
You believe?
Because didn't he call the doctor's office and it was confirmed? I mean, she might have made something up.
Told a friend.
Yeah. What do you think? I don't know.
I thought
Just
she
think-
was lying.
She
she
totally
was
acts
lying,
like
yeah.
physically acts like she's not pregnant.
Yeah.
Because yeah. I don't know.
Mhm.
She's manipulating.
Yeah. Very manipulative, right?
Yeah.
I guess HIPAA took a little bit of a break in the late late 80s here. I don't know. But consistent with, maybe HIPAA was alive and well back in 1987 or so. And maybe the number that he gets is really someone she's put to the task, and it's very manipulative. Well, we don't know. Does that at all tie, and I know for this generation, this is going to come from left field, but does this at all tie to that bunny scene, and how? So believe it or not, back in the 60s and 70s, there was something called a rabbit test, which is the way we found out that our female patients were pregnant. Right? So we used to actually take serum from our patients, and we used to inject it into a rabbit. Now, there's two schools of thought. One is correct, and the other one, sometimes adopted by Hollywood, is incorrect. The correct school of thought was back in the 60s, the rabbit was euthanized. And then beta-HCG was extracted from the ovaries to see if, in fact, there was a reaction, and if, in fact, there was increased beta-HCG, that patient would get a phone call, congratulations. Many took this idea to say that when injected, if the rabbit died, you were pregnant. If the rabbit lived, you were not pregnant, which is erroneous. Right? But that became known as the rabbit test, and Hollywood kind of captured that. And there's actually, I think, a 1970s film starring Dustin Hoffman that portrays this false belief that inject the rabbit, if they die, you're pregnant. If they live, you're not pregnant, which again is completely unscientific and wrong. Unfortunately, the animal was always euthanized, and the beta-HCG extracted from the ovaries was always.
So this was like a 1 pregnancy to rabbit ratio?
Yeah.
So many.
Horrible.
Right.
Horrible.
Right. Which kind of total tangent here, going totally tangential on you, puts Jordan Peele's Us in a little bit of a different light. And what the hell's going on with rabbits?
Oh my God.
Right. But I digress. Again, that film starring Dustin Hoffman is based on a misbelief. It's based on a myth. It's based on an erroneous interpretation of, quote unquote, the rabbit test. But I wonder if Dearden in this movie is suggesting that Alex is actually pregnant all along. Like the rabbit dies.
Well, that is the only scene she like throws up.
And remember, there was a scene where she had ice cream and cookies and Doritos all in the bed, and she's eating, and she's on the phone calling him. And when she's in his, when Dan is in the apartment looking for paperwork, there is a sheet that says gynecology or something, alluding to the fact that she had been to the doctor.
Maybe, but I also noticed those things, and I thought maybe this is just like not only like she's just like delusional.
And thinking that she actually is,
Yeah.
but she's not.
Yeah.
And-
Maybe she just wants to be, or she just has this like, fixation that this is the man who's going to give her a family, and it's happening.
And if so, it does support the idea in clinical medicine of stress-induced psychosis, which is often seen in individuals with borderline personality disorder. It's actually written as part of the depersonalization criteria, or stress-induced psychosis. That is, given a level of stress, an individual with this condition can actually present, quote unquote, psychotic with some breach in reality testing. All right, well, let's leave that here. I actually think that there's another option when it comes to determining what's going on with that rabbit in that rabbit scene, but we'll see if we have time later. First, I want to make sure that we have time to discuss our second feature of the day, and that's Gone Girl. So this is Amazing Amy.
12:23.
Cool. Right on time. Amy Dunn. What's going on?
She's like very textbook, I think, antisocial personality disorder.
Why do you say that?
She's highly manipulative, disregard for the rights of others, is willing to harm people in order to realize her own gain. Yeah, just like a very egocentric, self-centric view of the world. Her entire identity is based. She receives all of her validation from. It's all her concept, her self-worth. It comes from external validation, almost entirely,
Mhm.
and she wants to, and she like really revels in this idea of being admired by other people. That I think is a little bit different, but it's just also, things that describe her.
Yeah, I think that any time we begin to recognize someone as having that cardinal feature of having a blatant disregard for and violating others' rights, we have to think antisocial personality disorder. And then when you look at the diagnostic criteria, they begin to just look or serve as examples of that cardinal feature. And I think that's where this conversation starts with Amy. Any reason, if I were to bring up a counterpoint, that maybe this is a trauma response and she's in a marriage that is not only not validating or supportive, but abusive. Might this be the result of abuse? Any thoughts on that?
I feel like killing Neil Patrick Harris's character is not part of the trauma response.
Okay, that's fair. That's fair. There's even more evidence beyond that too. What is that? You bring up her past boyfriend.
Maybe that she's like not remorseful for anything that she does.
Lack of remorse is certainly a diagnostic criterion of antisocial personality.
I'm sorry.
I just wanted to say, doesn't he say she doesn't have any friends? Like, she doesn't have any close relationships with anyone except, I guess, for him, which he doesn't really necessarily have a relationship with
Mhm.
him.
Yeah, I think also just like the manipulation that she kind of has exhibited like throughout the past, like with all of her relationships, it's like a pattern where she uses people or she uses them to feel a certain way about herself.
Yeah.
And
If the behavior predates, in this case, her marriage, it's difficult to actually attribute the behavior to the marriage. And we see evidence, past relationships, prior boyfriends, that she's framed them. I think one is actually registered as a sex offender as a result, prior to her meeting Nick. So it's hard to look at the relationship. Now, we could look at her current marriage as a factor, maybe a social factor, that is perpetuating the behaviors, but we can't say that it's the precipitant to it. Not when we see behaviors that predate her anniversary. Right? So that's the way I would kind of approach this as a clinician.
Would we consider like her trauma as a child, since like her mom gave me like this aspect of like just try to portray her as a certain thing and getting that validation from like the books and stuff, like Amazing Amy, and like that pressure on her.
Yeah.
So her trauma as a child, maybe.
There is no chance that we would implement a biopsychosocial treatment plan for Amy Dunn and not address her relationship with her parents. There's no chance. That's where this conversation really begins in terms of, especially a psychotherapeutic perspective. Absolutely. Again, just to restate, by the way, I think both, as Mary Jo and Rand are Elliot, right? Aren't they both Manhattan-based psychologists? Not that there's anything wrong with that. Right. But you talk about this idealized version of their daughter and having this little girl needing to meet those expectations. And not only within the house, but then even shared outside the house in the publications of books. Right? She even says, I never had a dog. Amazing Amy had it. I never made cheer. Amazing Amy, or band, whatever. It's almost impossible to actually achieve. Yet these are the two very people that are supposed to do the direct opposite and validate in this case, your daughter, no matter what. Right? That's healthy infantile narcissism, which never is achieved. Right? Hence, why there's significant risk of developing a cluster B personality disorder. Right? Rule out antisocial personality. Now, what part of this, that is what part of one's, in this case, Amy's developmental history, may not fit with this provisional diagnosis of antisocial personality?
There must be evidence of conduct disorder
Yeah.
for age 15.
Yeah, and we just don't know, right? There certainly could be. Again, let's scream for the prequel, guys. But we don't see it, right? Or do we?
I think with her first boyfriend, I think it was in college, or was it high school? I don't know. I don't know.
I think it was college,
College, yeah.
so I'm not sure if it was younger than
Before,
15.
yeah.
I also don't like that criteria.
Hmm?
I don't like that criteria.
Why
I
not?
know the conduct disorder before the age of 15. I just think that I don't know, like a lot of like for so many other diseases, right? Like people develop them later on in life. Why can't we consider this something that people develop later on in life?
Any thoughts? And I think that's one of the reasons, not maybe the primary reason, but one of the reasons why we do adopt the clinical term of psychopathy. So we're not going to say that she's out of the woods or quote unquote completely normal, but we're not going to use antisocial personality either. So there's a term that we could adopt here, and maybe that's psychopathy. Is Amazing Amy a psychopath, if not afflicted with a mental disorder? One of the reasons why we diagnose antisocial personality as a disorder, as a mental illness, is because with evidence of conduct prior to the age of 15, there's a different natural history of the condition that is amenable to treatment, like any illness. Whereas without it, that the same does not hold true. And that's one of the reasons why. Now, the emerging literature, and this can happen, in subsequent editions of the DSM, prove otherwise, then you're going to see some adjustment of those clinical criteria. Any evidence that Amazing Amy may have conduct prior to the age of 15? Yeah, I'm going to take the collective pause as probably not, but something to consider here as well. Other thoughts about Amy Dunn?
At first I thought maybe she had like a
Trying to, like,
dissociative
finish notes.
identity disorder, because like clearly,
I'm listening between it, but
like she believes herself to be one thing. There's like the Amazing Amy thing where she's like, I want to be, I am not Amazing Amy. But then also living as Amazing Amy and like facing the press, facing all the fans. And I thought that was really interesting. It didn't seem like it was something out of her own volition. It was more of out of the will of her parents. But then as the movie progressed, the sentiments of like, her wanting to be something that maybe she wasn't, and wanting other people to be, so it just became interesting to me. And then she started, then she killed Desi.
Yeah. Mm-hmm.
Like she was writing like her own book in real life.
Yeah.
Which is true, because she was journaling and trying to fulfill that journal, even though she kind of derailed from the ultimate plan, which was to die by suicide. She decided to kind of rewrite that chapter and then take it a different place, which, again, authors sometimes do.
I think the thing that made me realize it wasn't us, because it was very intentional by her. It wasn't something that where it was like a lapse in memory and suddenly she was,
Right.
it was just very
Deliberate.
Very deliberate.
And premeditated.
Yeah.
Which is interesting, because if she's journaling, and she does, and again, I understand it's completely manipulative, but it does kind of bring up the question: has she journaled before? I mean, she doesn't look like a novice here, and if so, what does that mean? Where would she have journaled before?
In the
And why?
treatment program.
Right? And when might that have been?
Before the age of 15.
Which then brings us back to that question again. There might be some, albeit indirect evidence. I know we're taking some creative liberty. She's done this before. And if I were to consider where this might have occurred, it would have definitely been in therapy. Oh, by the way, her parents happen to be psychologists. Right? So I'm not so sure the conduct is off the table.
Yeah.
Final thoughts. Anything else here? Whether it's Amazing Amy, other characters in Gone Girl.
Oh my God, Ben Affleck's character, I thought was.
Nick?
Yeah, Nick. I feel like there are many boxes for dependent personality disorder that he kind of ticks off. It just seems like I can't tell if he's like depressed. It's like depression or major depression. That just leads to this just like apathy, or I can't tell really if it's like apathy or like passivity, where he either just really doesn't care about things and it just doesn't affect him, or if regardless of whether or not things affect him, he sees himself as a passenger in his own life, and he expects, either his sister or his wife or his new girlfriend to fix all of his problems for him and manage his life. So, yeah.
I think you're right on there, and I think something you mentioned is what I would ask everyone to consider as a perhaps provisional or working diagnosis, and that's from the depressive disorder chapter of the DSM. We do know that they move out to Missouri because his mom's battling cancer. She does pass on, and again, I want to know what symptoms predates the death of his mom versus those that might be new onset, because if new onset, maybe we are dealing with a depressive illness, or major depression.
I think that correlates because also I believe his father has Alzheimer's, which is why he's in assisted living, and so I feel like his only other sibling is Margot, who they're twins. So there's no really like older figure that kind of he could like lean on for the support. So it's like I feel like it also I don't know if there's like a psychology behind the twins idea versus like an older versus younger sibling, but it's like when you're of similar age, then it's like there's less of that line of like who's older, who's younger, who's the supported one, who's the dependable one type of thing. So I feel like that also kind of plays into a role.
I agree. No, I agree. He's a very complex character. Which then, just to fast forward a little bit, what's going on with this ending? Like, why does he make the decisions that he does? Any thoughts here?
Well, I think Amy recognizes this about him. She, has kind of been playing him this whole time. She understands how he's going to react to things, and when she made the decision that she did sort of like last minute, that she wasn't going to kill herself and she was going to play the happy family game a little longer, she knew he was going to go along with that. Whatever she decided, even without the blackmail and this and that, like it was, she knew she could work him how she wanted to.
How about from his perspective? And I agree with you, but how about from his perspective?
I think that's what I was confused about because I think he made a statement saying that like when he was agreeing to go on to the interview, which was initially like a really bad idea that he considered and like his sister agreed with, I think his statement was like, because his defense attorney told him to gain sympathy from the public so that like his side of the story could be told that he wouldn't be charged for murder of like the potential murder of his wife, but then in the end I think he ended up saying like, oh, I only really have to reach one person, which is he was trying to reach for her, and I got kind of confused by that as to like why he all of a sudden switched up on like deciding like, oh, I don't really need to gain the public's attention, I just have to, if she's really alive, I have to just gain one person's attention.
I agree. Anybody else have any insight to this or thoughts?
It almost seemed like he, while solving her scavenger hunt, he was doing a deep dive into like, the inner workings of her mind. And in this process, he began to understand exactly who she was and what she was doing, in the same way that she had come to know exactly who he was and what he was doing throughout their marriage. And in that sense, I feel like as he was speaking to her through the screen, that was his objective, to get her back. I don't think he maybe thought far enough to realize that she would also they would have to make that decision at the end where he either lives with this for the rest of his life or he doesn't. But she knew him that well, and in her explaining, this is our only choice, like what, I think he realized too, like, I think this is my only choice, because they just knew each other so well at that point.
Any other thoughts?
I feel like character-wise, they portray like character foils of each other because Amy was like, she has like elements of like narcissism also because they described her as like she wants to play God and that she always has to like control these aspects of her life, versus someone who is now her husband that's like needs all aspects of his life to be controlled. So it's kind of like they almost like fit this like very bad puzzle with the fact that like they're kind of like this.
Could they? Yep. Well, let's leave it there.